Give us a sense of how good this news is for the state of Connecticut.
I think it's really good news for the country, actually, David. Thanks for having me back. Look, we know that we've got our budget set for the next couple of years. We know that we don't have to raise any taxes. We know that there won't be any broad layoffs, and that's all thanks to the state and local aid. But more importantly, I love what we're doing on education. We have our schools have been open since September, but we still have 30–40% of our kids who haven't been in the classroom for 9 months. We've got a lot of catching up to do, and it's a chance to make sure that wasn't a lost year. We can build off of it.
So what are you going to do with the money that you get? I mean, as a practical matter, you just mentioned employment issues, your budget and taxes, but where's the money really going to go? Where are you going to spend it?
Well, first of all, on education, I can tell you the school year doesn't end on June 25th. It restarts again on July 6th. And we're going to have a lot of activities in and around camps and learning and experiential. A lot of kids who really haven't been with their peers in a long time, and doing everything you can to help them catch up. Maybe bring some college kids in as apprentice teachers to help them learn and have role models there. And then come the fall, we'd have after-school activities, social workers, and help these kids hit the ground running.
Is there any consideration at all of extending the school year?
Absolutely. I mean, whether I legally extend the school year or just say starting July 10th, we're going to have 2 months of summer programs, we'll figure out how to phrase that.
So if it's in fact the case that the schools are open, but you don't have all the students back in the classroom, what is the barrier? Why aren't they back in the classroom?
It's sort of tragic, David. I mean, in our suburban towns, our more rural towns, predominantly white towns, 90% of the kids are back. But a lot of the kids in our urban centers, small as they may be, more likely to be children of color, they were hit particularly hard, or their families were, by COVID, and they've been a lot more reluctant to get back. But now we got our teachers vaccinated, our healthcare frontline and the schools are vaccinated. They're calling up the kids saying, come back for the final 2 months. It's worth it.
Are all your teachers back, or essentially all your teachers back?
Yeah, essentially they're all back.
What other effects will you have? And talk about employment, because we saw in the last employment numbers for the country, the place where we really lost a lot was actually in state and local employees. What's happening in the employment situation in Connecticut? Where are you compared to a year ago? Where are you going?
In terms of actual state employees, that number has been trending down for quite some time. And frankly, I don't see us ramping up a lot. It's not COVID related, but we're making more investments in computer technology so we can be a lot more efficient and less cost. I'll tell you the other thing I'm really excited about, David, is the money for daycare and childcare. We lost a lot of employees in the service industry, overwhelmingly women, often women of color. And the fact that we're going to have heavily subsidized or even free daycare and childcare for the rest of this year can make a big difference in helping them get back into the workforce.
Governor, what about infrastructure? Because one of the things we've heard about is not only a promise perhaps there's infrastructure coming down the pike, but also that some of the money going to state and local government could be used for infrastructure. Is that true in Connecticut?
That is. It's not big dollars for infrastructure. We need that infrastructure bill going through. And we've got old infrastructure here in the Northeast. As you know, this stuff was all built, 60, 80 years ago. So what I've got our Department of Transportation doing right now is doing the design, build, engineering, ready to go. So when the federal government says, here's our infrastructure plan, it'll be funded 80-20, Connecticut can get in the front of the line and get some of that.
Give us an update, if you could, Governor, on where COVID is in the state of Connecticut. I've been sort of watching the positivity rates, and they've been coming down for you. Where are you in terms of the extent of the disease in the state and restrictions?
So when it comes to, infection rate, like the rest of the country, we've come down. It's not down to, 1%. It's hovering around 3%. But the good news, David, which people ought to pay more attention to is they tend to be younger people who are a little more likely to be the ones who are infected now. Folks 55 and over are overwhelmingly vaccinated or will be in the next 10 days or so. So we have a lot less infection, a lot less complications with the most at-risk group. So I think even though we have sort of a 3%, 2 to 3% infection rate, it's not really impacting our hospitals, emergency rooms, ICUs, fatalities. Those numbers continue to get better.
Where are you on the restrictions? Texas, of course, and Mississippi have just taken them all off. It's only voluntary. Where is Connecticut? I think I heard on the radio that you're going back to 100% in restaurants. Is that right?
Yeah, that is true. We're doing, restaurants, retail, houses of worship at 100% occupancy, but we're maintaining the mask requirement and we're maintaining the 6 foot of distancing. Look, some things are just not very enforceable. A lot of governors, we're going to go from 50% to 70% to 90%. You really can't enforce that. But what we are doing is saying the mask is really important. The mask works. A lot of folks in Connecticut, they want to get back to that restaurant, but they're going to probably peek around the corner and make sure people are wearing the mask before they go in. So I think it's going to balance it out. But the good news is our economy is beginning to rev up.
Give us an update on the vaccination program. Where are you in getting people in Connecticut vaccinated?
I think we're doing pretty well on that. We've had some changes compared to the CDC, so I'll be blunt about it. There was some back and forth on that. CDC said comorbidities and essential workers, and we found, well, that's not much of a help because that's about 2/3 of our population. And then you just had everybody rushing the gate at the same time. So we went from 75 and above, 65 and above, 55 and above. In about 10 days, it'll be 45 and above. But that really is based on public health, too, Dave, because that's where 90+% of the complications take place, age group.
Are you getting enough vaccine to get into people's arms? I mean, where's the bottleneck at this point?
We're getting twice as much as we had the day that Joe Biden was inaugurated, so that's good news. And we can use 3 times more. The appetite is there. We have the infrastructure in place. We have the mass vaccination in place. But I was talking to the COVID task force the other day. We really got to think about how you get the final 30% of the people vaccinated. They're often people of color, or they're just anti-vax or vaccine hesitant. And I do worry that we have more vaccine in the next month. We may have to stimulate demand a little bit. A lot of the younger people may say, hey, it's over. That's not good.
So you're really meeting some resistance, at least among some of the population.
Yeah, I wouldn't call it resistance. I would say that there is some hesitancy. Look, we did the nursing homes, let's say 2 months ago. Our first round of the nursing homes, maybe 30% of the nurses actually wanted to get vaccinated. The other 70% said, hey, maybe I'll wait. Then we came back 3 weeks later. We got another 1/3 vaccinated. So we're ramping up, but there will be a group, maybe in the younger demographics, that you're going to have to really incent to get vaccinated. Maybe get incented by having a restaurant that says, hey, I've got a card that says I've been vaccinated. Come on in.
Governor, give us a sense about the state of the economy in Connecticut more broadly. Let me start with one basic question. To what extent have people left Connecticut? To what extent have the people come to Connecticut during the pandemic?
Yeah, for the first time in 10 years, David, more people are coming to the state. I think we had about 50,000 move into the state, about 18,000 families during 2020. A lot of them from New York, to be blunt about it. A lot of younger families deciding, hey, look, I was a millennial. I thought the big city was the place I had to be. But now, given COVID, given the fact that our schools are open, given the fact that maybe a nice backyard is sort of a nice thing to have when in a quarantine time, we have a lot of young families moving into the state.
How many of those are upper income as opposed to middle income or even lower income?
A lot of them are, more upper income. And we saw that reflected in capital gains, tax revenue, and some help to our budget.
Well, what about that capital gains? Because we hear from some Republicans, particularly on Capitol Hill, that states like Connecticut really didn't need the money from the stimulus, that actually it's sort of a giveaway to some, forgive me, blue-driven states.
Yeah, I think that's absolutely nonsense. And first of all, don't give me this blue state bailout stuff. Florida and Texas are the 2 states that had the biggest revenue shortfall, most in need. And mentioned to Senator McConnell that no state has a bigger unfunded pension liability than Kentucky. So I thought that was a really false rap. Look, we did have some revenue shortfalls. Most states did. Some states did very well. But I think more importantly, this gives us some certainty to make some investments we need. And I mentioned education and childcare being really important, and broadening the base of people on the exchange. More people can get health insurance. These are enormous changes that I hope are not just for 2 years, but forever.
Governor, one of the questions about the longer-term prospects for Connecticut is your IT system and whether you've allowed investment, encouraged investment enough. I know you've just signed, I believe, into law a provision to give a tax break for some data processing centers. Are you behind on that, or maybe let me put it in a more affirmative way? Is there money to be made there for the state of Connecticut? Is there upside opportunity?
Absolutely. I mean, these data centers are the seed corn of the 21st century economy, not just tech companies and fintech, but look, the trading floors of the future are going to be these data centers and the ecosystem that grows up around them. So, yep, we made a significant investment there. I think people know that we have a pretty reliable electronic grid here. You see other states where the grid is crashing. That reliability is extraordinarily important to a lot of these data centers and the users there.
Governor, give us some sense. You made one reference to it. Some sense of the extent to which the relationship between Connecticut and Washington has changed under the Biden administration. Obviously, you're a Democrat. We have a Democrat in the White House. But how have you seen concrete manifestation of a change in the relationship between your state and the federal government?
I think it's a partnership, and it's a lot more collaborative, David. I mean, it was a little herky-jerky under the Trump administration, and every meeting was a sort of a surprise. I think one of the first things when Jeff Zients came in, they asked the governors, me and Bill Lee, the governor from Tennessee, sort of represent the governors when it comes to the COVID task force. But give us a little perspective. Give us a window. Tell us what the vaccine rollout looks like over the next 3 or 4 weeks, not just with a 5-day notice. That allows us to build the vaccination centers and make the investments looking forward. And the Biden administration responded on that. And I got to say, it's helpful for blue and red states.